So hello, everyone, and welcome. Thank you so much for joining me this evening. My name is Elisa Kenichi Turkildson, and I'm one of the Dissemination and Implementation Specialists here at Language Dynamics Group. I'm also a speech-language pathologist and a PhD student studying under Dr. Doug Peterson at the University of Wyoming. I have one of my fellow colleagues here with me this evening, the amazing Christy Jones, and she will be in the chat answering questions. Hello, Christy. And Dr. Megan Kirby may pop in later as well. So if you see her, that will be amazing. However, if we run out of time, so Christy will be answering chats in the chat there, or answering questions for us in the chat. However, if we run out of time or questions come up later, just please email us at training@languagedynamicsgroup.com. There will be a QR code at the end of the presentation, and this will take you to a survey and your certificate of completion. And so you can use this for continuing ed credit. In addition, a recording of this session and a PDF handout of the slides will be posted on the website within the next day or so. So today, to get started, I will be discussing a multi-tiered system of language support, or MTSLS. We will define MTSS and then look at why the L is added and discuss how MTSLS can be implemented. So like I mentioned, we're going to be doing a deeper dive into multi-tiered system of language supports and how products from LDG or Language Dynamics Group are easily integrated into an MTSS framework. Now, it's important to keep in mind that MTSS is not linear in nature. Instead, we are frequently circling between benchmarking, progress monitoring, and intervention. We let the data help drive our decision-making and where we should go next, depending on whether that's intervention or progress monitoring. However, for the ease of our discussion tonight, the integration of these products within MTSS will be shown in a more linear fashion. Before we dive into those various products from LDG, I want to clarify MTSS and make sure we are all on the same page. So multi-tiered system of supports is a framework for organizing instruction in a manner that differentiates it for all students according to their individual needs. It has 4 core elements. First is universal screening. Second is progress monitoring. Third is tiered instruction. Now, it's important to keep in mind that the curriculum should be available for all 3 tiers. And the fourth thing is data-based team decision-making. MTSS is what an entire school uses as a model to support the academic and non-academic needs of all students. It is a student-centered educational framework. In MTSS, school teams identify where students are at via universal screening, then make data-informed decisions about which students are at risk and need additional supports. Then, already in place in each classroom, teachers use empirically supported, evidence-based instructional tools and monitor students' progress as needed so that they can intervene early when one or more of their students are not acquiring skills at a rate that they should, given effective instruction. I think one of the key takeaways here is that MTSS is for every student and should take into account the whole student. And you'll probably hear me say that a couple times tonight. So the differences between MTSS and RTI. This is a common area of confusion. What is the difference between these two? While both are problem-solving models, there are several key differences between MTSS and RTI, or response to intervention. First, RTI is an academic support system for at-risk or struggling students. The key word there is that RTI was designed to help teachers address the needs of students who are already not performing at grade level. These students are at risk. The whole emphasis is on the identification and support of students who are already at risk for failure. Not all students need intervention, so not all students are part of the RTI process. Conversely, MTSS is a more holistic model that goes beyond the classroom and is implemented within the entire school. It focuses on providing high-quality instruction and interventions, typically at 3 different levels. MTSS may include the three tiers of RTI, but it also incorporates other programs. Remember, MTSS takes into account the whole student and every student. The construct of response to intervention is typically used within the MTSS model to determine when a student needs to be evaluated for a disability. RTI is a more valid procedure for identifying students with disabilities. A major benefit of an MTSS model is that preventative interventions can be provided to anyone who needs a little something extra. So MTSS is preventative. MTSS is not something that students are put in necessarily. It's more like a theory or a framework. It's also not a curriculum, nor is it something that only certain staff implement. MTSS relies heavily on multidisciplinary problem solving and school teams that meet regularly. Remember, the data will drive our decisions, so we need to gather as a team to analyze that data. And this framework does not rely on a specialist. Instead, like I was saying, it requires a very collaborative team effort to implement. So this graphic here contains colors that correspond with the different types of intervention found within Story Champs. If you're familiar with Story Champs, you might be familiar with the color scheme here. So whole group, small group, and individual sessions. This is just to keep it simple and to show how Story Champs aligns well with MTSS. But what do these tiers really mean? So tier 1 is whole class or large group grade level instruction using research-based curricula, which is what it should be coming from, right? We want it to be research-based. Approximately 80% of all students at any given time will only require tier 1 high quality instruction from a general education teacher in the classroom. So as you can see from the graphic here, that's the purple. It makes up a majority, about 80%. Now tier 2, think of this as a supplemental dose to the whole group instruction. Tier 2 is small group intervention targeting specific outcomes when students are not demonstrating progress at tier 1 alone. About 15% of the students in that general education classroom may need supplemental tier 2 instruction within a small group setting. So that in this graphic, it is the yellow. And tier 3 is for the remaining approximately 5% of the students who require more intensive and individualized instruction in addition to the large group lesson they participate in with the whole class during either another part of the day or a different time of the week. We actually skip the whole group and provide that one-on-one instruction. So you will know if a student needs tier 3 if they are falling far below benchmark expectations. And I will cover how to benchmark and progress monitor here in a bit. But with this intensive instruction, hopefully the scaffolding can decrease and the student will only need small group or potentially return to whole group instruction. Now keep in mind, these numbers are averages and every classroom may look a bit different. Additionally, it's important to reiterate that all students will continue to receive tier 1 whole group instruction. So if there's a student who needs that tier 3 instruction, it's not that they only get the one-on-one support. They also participate in the whole group instruction. However, some of those students just may need a little bit more intensive support. So why add the L to MTSS? You're probably wondering why this addition is so important. Well, more than 1 out of 3 US 4th graders cannot demonstrate basic reading skills. They're not meeting proficient levels. And we're not just talking about decoding and phonics here. In fact, according to that same study, that same NAEP assessment, more than 90% of those students are actually reading at a fluent level. So following the simple view of reading, which posits that reading comprehension is the product of word recognition and language comprehension, if decoding is not the underlying issue, then the students must be having difficulty with language. If you decode something beautifully, that's great. But how can you understand something if you don't have the language to comprehend it? Strong oral language is critical for bolstering students' success in school. More specifically, students need strong oral language that is similar to the complex language that is found within the school setting. In fact, oral language is so critical that state educational standards, for example, the Common Core state standards, include objectives for speaking and listening in addition to reading and writing. These language-based skills are highly interrelated and essential for academic success. Students who do not have an adequate oral language foundation have considerable difficulty meeting those academic expectations. So going back to the addition of L into MTSS, language is critical and often overlooked. Therefore, Dr. Spencer and Dr. Peterson wanted to highlight the importance of language by making this distinction and giving language its own letter within MTSS. The L needs to be front and center. You can decode all day long, but you will not progress without the language portion. It is also a good reminder that language is not just for specialists like speech language pathologists. The entire school team should be focusing on language. And if you really think about it, language is everywhere in the school setting. Not only is it necessary for reading, but also areas like math, science, and behavior. So it is integral to all content areas and beyond. And we want all educators to recognize the importance of language. So now if we start using MTSLS, so in an MTSLS system, screening and progress monitoring are essential. Criterion referenced assessments best align with the MTSLS system because it compares a student's score to the benchmark expectation. Remember, MTSLS is for every student, not just for the students who are struggling and failing. So let's say, for example, 80% of your kindergarten class is not meeting beginning of the year benchmark expectations for oral language. This does not mean that 80% of your students need an IEP and have a language disorder. Instead, maybe these students have not been exposed to the skills that are expected of them. There's just some gaps. Therefore, it's important to differentiate who will need whole group instruction, additional small group, or even individual instruction. Now, your curriculum, like I mentioned earlier, should include these varying levels of differentiation. If it doesn't, that will take a ton of time and planning on your end or whoever's in charge of the curricula within the school to ensure that all three levels have access to the curriculum. There are not many criterion referenced assessments that truly measure the construct of language. But tonight we'll talk about the cubed 3 in a few minutes because this assessment fills a much needed gap. Again, our recommendation would be to use a criterion referenced assessment for MTSLS as opposed to a norm referenced assessment. Typically, those norm referenced assessments are used to identify or diagnose those students with a disorder. So more aligned with like the RTI system. Here's a great graphic that displays the products from LDG that fit into an MTSLS framework. These products include the Pearl, the Cubed 3, and Story Champs. Now keep in mind, these products are the result of many years of research from Dr. Spencer and Dr. Peterson. If you're interested in taking a deeper dive into the research, you can find the manuscripts online at languagedynamicsgroup.com. There are also reader-friendly infographics next to the manuscripts with the results of these studies, if that's more your style. And in order to make the MTSLS system work, you have to have assessments and intervention, both components. So remember, the assessment needs to fulfill 3 purposes. Universal screening to answer the question, what do our students need? And not just certain students, but all students. Next, your assessment should allow you to plan interventions. You should have enough high quality data to know about each individual child and what they need to focus on. And the assessment should allow for frequent progress monitoring that aligns with the intervention. This progress monitoring should occur regularly using the same or similar measure, so you know that the child is actually making progress. Basically, once we identify what our students need, the MTSLS system then addresses the question of how can we provide resources to teachers based on the principles of effective instruction that ensure all students have access to evidence-based language instruction. This slide really simplifies the process even more using these 7 steps. So you're going to gather the data, analyze the data, determine strengths and needs of each student, group those students based on need, identify evidence-based language instruction, implement the instruction, and then repeat. One reason why we may be seeing really poor reading outcomes in 4th grade and beyond is because students are not being identified as being at risk for reading failure in those early grades, like as early as kindergarten. We're just not there yet. I may have a solution though. So universal screening is a key ingredient in any evidence-based language program, because when we screen 2 to 3 times per year, we get data about the effectiveness of the program while also identifying students who indicate they are at risk for later language difficulties. Assessment drives the delivery of instruction and intervention within the MTSLS framework. Specifically, universal screening involves assessing all students in the grade or school on specific domains to identify which students fall below the expectations. That information is then used to allocate supplemental interventions to those who need it. This figure here is from the Cubed 3 manual, which you can find online at languagedynamicsgroup.com. And it depicts the recommended Cubed 3 and Pearl benchmark timeline for administration. There's also a sneak preview of how the diamond will fit into the picture there on the bottom right. Now keep in mind that these are only general guidelines and that your school or district may have different needs. Those areas that are emphasized in the curriculum will drive the assessment process, and mastery or benchmark levels will determine whether certain subtests and measures are required. So one dynamic assessment that we're going to focus on today is the PEARL. PEARL stands for Predictive Early Assessment of Reading and Language and is aimed to be used with preschoolers and kindergartners. There's a QR code in the bottom right if you'd like to check out the PEARL on the LDG website, but I'll jump quickly into what it is and how it works. So in the top right, you can see an image of the assessment kit. The PEARL kit includes an examiner's manual, the stimulus book, and 25 student record books. The 2 primary purposes of the PEARL are 1, to accurately predict future decoding and comprehension difficulty. So who is struggling now and likely to continue to struggle if we don't provide some extra support? And the second purpose is to reduce the cultural and linguistic bias of the information through the use of dynamic assessment. This assessment measures a student's ability to learn specific language and decoding skills instead of just measuring what they already know, thereby reducing bias for diverse students and allowing for earlier identification and intervention. So first, we're going to talk about the decoding subtest of the PEARL, because remember, there's also a language subtest. Now, the PEARL is meant to be administered individually. So as I go over the basic procedures in the next few slides, just keep that in mind, because otherwise you're going to be thinking, how the heck do I do this in a small group or a whole classroom? But it's quick and it's an easy screener, meant to only take about 8 to 12 minutes. This is the decoding pretest. The stimulus book would be the 4 nonsense words that you see right here at the bottom of the screen. You would put that stimulus in front of the student with those 4 words and then say, please read these words, while pointing to each word. In the upper right-hand portion of the screen, you will see the scoring section. You would underline the sounds that the child reads correctly, even if they do not blend all 3 sounds together. For example, if they were to say t, a, d, they said all 3 sounds correctly, so you would score all 3 sounds as correct. We don't expect our kindergartners to blend perfectly yet, right? However, you will see a range of abilities. So if a student reads 2 or more words correctly, Don't continue with the decoding subtest. Instead, move straight into the dynamic assessment of language subtest, which we will cover next. You'll notice that we use nonsense words in this subtest to rule out any unfair advantage some students may have by coming to the table with maybe some sight word knowledge. Now, if this were a static assessment, we would normally stop right here, but we're not done. So for our students that do not read 2 or more words correctly, we continue within the decoding subtest. What makes the Pearl a dynamic assessment is the next step, a teaching phase. You will see those 4 words on the bottom, and you will actually teach the student how to decode these words. You do this for all 4 words, and you follow the teaching script for round 1, as seen on the left-hand side of your screen. It says, I'm going to show you how to read these words. This letter says, say. This letter says, ah, say, ah. This letter says, d, say, d. Put them together, and you get the word, ad, had. What is the word? And then after you finish that, in real time, you will fill out the responsiveness scale. And this is very important. You can tell the student, okay, that was great. Let's give your brain like a quick 10-second break while I fill this out really quickly. And students are usually good about just hanging out for a quick second while we complete this scale. So when completing the scale, you will consider how many errors they had, what was their confidence level, their disruptions or disruptive behaviors during instruction, and their rate of learning. It's important to note that this is a rating of their responsiveness to the teaching phase and not how they performed on their pretest. Finally, you will rate their overall ability to learn with the 4 to 0 scale that you see there at the bottom. And then we'll move on to the post-test phase. It's still the same words, but now the order is mixed up. You once again follow the script in the upper left. Please read these words as you point to each word and score each student's correct sound and the correct words that they read. And that's the end of the decoding subtest of the Pearl. It probably takes me longer to describe how to actually administer the test than actually doing it with a student. So now let's move to the language subtest. This is where we are going to address the other half of the reading construct, oral language. Even though we can't quite measure a kindergartner's reading comprehension because they most likely can't decode or they're just beginning to decode, we can measure their language comprehension, which is equally valuable. And we do this through the oral modality. So similar to the decoding subtest, we have the pretest, a teaching phase, and then the post-test. This is what the dynamic assessment of language pretest looks like. You don't have any stimuli in front of the student at this point because we need a true measure of their language skills without visual prompts or picture supports. So the student listens as you read aloud the scripted narrative and then say, thanks for listening. Now you tell me that story. And as the student retells the story, you score in real time for the inclusion of story grammar elements, language complexity, and whether or not they include a complete episode, which in this case is a problem, an attempt, consequence, and ending. If you're familiar with the cubed 3, you'll find this very easy to administer. If this is the first time you've heard of the cubed 3, don't worry. We have some recordings of prior webinars and videos on it on our website. The link probably has been shared in the chat, but if not, I know Christy's on it, so go to languagedynamicsgroup.com, and that's where you can find some of those videos. This is what the teaching phase looks like within the language subtest. So now you'll see that we use the stimulus book during our instructional phase. And again, if you're familiar with our other products like Cube 3 and Story Champs, you'll recognize some of those familiar icons down there. So you'll go over the story again with the picture and icons available to the student, and then ask the student to retell and offer assistance as needed. If the student skips a part or provides an incomplete or unclear response, then you use those level 1 or level 2 prompts that you see on the right-hand side of your screen. For step 3, we remove the illustrations, but keep the icons out. So you just flip the page in the stimulus book. And we help the child retell the complete story using prompts as needed. And then finally, for step 4, we fade out the icons. We ask the student to retell the same story that they've heard 3 times so far, so including the pretest. In real time, we're filling out that responsiveness scale, and you'll provide a brief rating for prompts. So how many prompts did you have to provide for them to be successful when retelling the story? What was their confidence level like? How many disruptive behaviors were present during the teaching phase? And how quickly did they pick up the ability to tell the story using all key story grammar elements? Then you're going to give them that overall learning score. Remember, it's not about the mistakes made, but more importantly, how did they respond to your teaching? How effective was your teaching for them? And then after you fill out the responsiveness scale, you do a post-test, which is very similar to the pre-test, but it's a different story. Because at this point, we would probably just end up measuring the child's ability to memorize one story if we kept it the same. That way, we assess in real time the effects of instruction on the child's ability to retell a novel story. I do think it's important to note that with this post-test, you do not have any stimuli out for the student. Just like the pre-test, there are no pictures and no icons to go with it. And so now you have to do something with those scores, right? You would add up your scores and put them here. And then what we do is we use this flow chart to see whether intervention is recommended based on difficulties identified during the dynamic assessments of decoding and language, or if a student is not at risk. So for example, if a student got a 4 on the dynamic assessment of decoding pretest, did the student read at least 2 words correctly, blended or segmented? If yes, they're not at risk. If no, then was their learning score on the responsiveness scale a 0 or 1? If yes, stop there. Intervention is recommended. And you would continue to go down that flowchart to rule out or identify any need for early intervention. Similarly, you'd use a flowchart here on the right for the language subtest. You'd start with the episode. So which elements of a complete episode were included? Then move to the responsiveness scale, and so on and so forth. So which students have we identified to be at risk? As we think about this, it's important to consider the sensitivity and specificity of the assessment. Sensitivity is how accurate is the measure in classifying a student who has a disorder. Essentially, how accurate is the assessment in identifying true positives? On the other hand, specificity refers to the accuracy when identifying typically developing students, or those cases of true negative. A lot of research has been done, but to give a few examples of the decoding classification accuracy, a group of 800 students in Utah, with 600 of those followed up until the end of their first grade year. This study compared the Pearl against Dibbles in accurately classifying students with and without a language disorder or reading difficulties. The Pearl had 92% sensitivity in accurately identifying those students in need of targeted intervention and was able to accurately predict students who did not need intervention 83% of the time. These outcomes were better at catching issues early on when compared to the Dibbles. Furthermore, just look at those outcomes for the population of Hispanic students. There was 100% specificity for the Pearl compared to the 87% for Dibbles, which 87% is not bad, but it's no 100%. Regarding the process of ruling out students who did not need intervention, the Pearl outperformed Dibbles once again, which means Dibbles may be classifying our dual language learners as having language disorders or reading difficulties, when in fact, They really do not. In Arizona, another Pearl study was conducted with kindergartners and found 90% sensitivity and 86% specificity. And if you want some more, here's just a quick overview of some of the studies on the Pearl reporting the dynamic assessment of language subtests and the classification accuracy. And as you can see, sensitivity and specificity were very high across the board, even for our multilingual students. Using the data from the Pearl and the Cubed 3, your team can now make decisions regarding who needs intervention, what should they be taught, and identifying specific skills to target. Additionally, you can also make decisions about when intervention should be adjusted. Starting on page 19 in the Cubed 3 manual, there are administration flowcharts for preschool through 8th grade. Here's an example of kindergarten beginning of the year flowchart. So you would start with the Pearl and potentially move to the Cubed 3 if you had concerns or if your school wanted benchmark data for every student. If warranted, you would then provide intervention and monitor progress with the Cubed 3 and then repeat the cycle. And you can see, it might be a little difficult to see in this graphic, but the recommended subtests are have solid lines around them. And then the optional targets are the ones with the dashed lines around them. Again, this can be found on page 19 in the Cubed 3 manual, which is available on the LDG website. Here is an example of a 2nd grade flowchart. You would start with the recommended subtest of the Cubed 3, provide intervention as needed, monitor progress, and repeat the cycle. So you can use these flowcharts as a reference to determine when and how many of the Cubed 3 subtests and measures to administer. So these are extremely helpful, and I highly recommend downloading the manual and taking a look at these flowcharts. But what if most students fail to meet the benchmark? So like I mentioned earlier, it is not that all of your students require an IEP or a diagnostic evaluation. Instead, if less than 80% of your class is at benchmark, consider increasing your attention to the promotion of complex language that students encounter within the school setting while you provide that Tier 1 instruction. To make things even easier, consider an evidence-based oral language program that already addresses complex vocabulary, complex sentences, and discourse structures, like Story Champs. Everything is right there, ready-made, ready for you to go and use in the classroom. Conversely, if more than 80% of your students meet or exceed the benchmark, then consider the Tier 2 supplemental support for this smaller subset of students that just need that additional support, along with the whole group instruction. Which students benefit from explicit oral language instruction? The answer is actually really simple. It's all students. All students may benefit from explicit oral language instruction. In most schools today, there's very little emphasis on the complex language found in curricula. So even typically developing students with average language skills could benefit from an increased focus on the academic facets of language. However, Story Champs is clearly vital for students who are at risk for academic failure, including students with disabilities or students who have maybe a mismatch between home and school language, dialect, or culture, like our multilingual students. Given that Story Champs is a multi-tiered curriculum, the lessons can be differentiated for any student or group of students. Almost 2/3 of students are not meeting the academic reading standards in schools. Story Champs, with its accompanying principles of language instruction that are generalizable across the curriculum, give these students the boost in complex language they need to succeed. Narrative language provides students with instruction in the patterns of words, the patterns of sentences, and the patterns of discourse. Story Champs gives them a mechanism that produces generative language and the tools needed to access other language opportunities. So as a result of narrative language intervention, now kids talk more. They get reinforced by their peers when they tell a story or by their parents or teachers. So then they are practicing more language, more complex language, and accessing this language in their classroom curriculum. It just might take a little while for all of that naturalistic language input to have the effect that we're hoping for. Story Champs was designed to be a multi-tiered curriculum so that it is easy to use within the MTSLS system or RTI, the response to intervention models. Story Champs lessons can be implemented in various arrangements, including large groups, small groups, and with individual students. Each lesson lasts 15 to 45 minutes, depending on the arrangement and language needs of the students. The advantage of aligned tiers is that the students with greater language needs receive more intensive intervention, whereas students with fewer needs participate in a low-dose intervention that is sufficient to support their academic language development. Importantly, the curriculum adheres to the same principles and instructional approaches across all tiers. So students who move between the tiers are not confused by conflicting approaches. How is Story Champs tiered? Well, the Story Champs system offers a large number of targets, lesson plans, and stories. Because targets, lesson plans, and stories can be combined to make an almost endless number of combinations, the interventionist has a responsibility to be prepared and plan for what the students need, as well as continue to make adjustments to the intervention as you're providing the intervention. The data gleaned from assessments, especially the Cubed 3 assessment system, will be the most helpful in directing interventionists to the correct targets, lesson plans, and stories. Choosing a lesson plan requires a decision about what arrangement is best for the lesson that will be taught. If there are more than 4 students in a group, then you should use the large group master lesson plans or the purple colored lesson plans. If there are 2 to 4 students in the group, small group master lesson plans, or the yellow ones, are what should be used. Green master lesson plans are reserved for the interventions delivered to a single student at a time, or there's those one-on-one sessions. So what does it look like? Well, here's a study from 2018 by Spencer and colleagues. They examined the efficacy of multi-tier narrative intervention on language comprehension skills of preschoolers. Additionally, they explored the implementation variables such as teacher and teacher assistance, intervention fidelity, and scoring reliability. So they had 3 Head Start teachers and teacher assistants deliver multi-tiered instruction over the course of 1 year. They completed progress monitoring throughout this year, and then 3 other classrooms served as the control group. What they found is that preschoolers in the treatment classrooms had statistically significantly higher story retell scores and listening comprehension scores compared to the control group. They also found that teachers and teacher assistants delivered instruction and intervention with fidelity and reliably scored progress monitoring assessments. If you would like to learn more about Story Champs or see demonstrations, you can scan this QR code here, which will take you to the Language Dynamics Group YouTube page. And I believe Christy will also drop a link in the chat as well. So ideally, if a student requires additional intervention like Tier 2 or Tier 3, then progress monitoring should occur every couple of weeks to ensure the effectiveness of the instruction. The digital Cubed 3 system has some incredible features that help you visualize the data and determine continued areas of need. There is a QR code here if you're interested in learning more about the digital version of the Cubed 3. Additionally, you can find the recording on LDG's website of the webinar from April, where Dr. Peterson actually walks you through some of these features of the program. So we won't go too in depth tonight since there was a webinar done just a couple months ago, but I do want to cover some of the basics. So progress monitoring should include these 7 things: measure socially and academically important outcomes, have alternate forms, strong validity and reliability, standardized procedures, be efficient and easy to use, and be sensitive to growth over time. Now, that is a lot to ask of a progress monitoring tool, but the Cubed 3 does this. So you don't have to wonder if your progress monitoring tool includes all of these 7 elements. Now, if you're using something else besides the Cube 3 to monitor progress, I would challenge you to look and see if the tool you are using meets these 7 requirements. The Cubed 3 measures the constructs of both language and decoding. And this graphic shows the language measures subtests and how they align with the different grades. Within the NLM reading, there is the retell, questions, fluency, and personal writing generation. This is aimed at grades 1 through 8. And then the NLM listening includes the retell, questions, and personal story generation. This is more for like the pre-K through 3rd grade. It is recommended that benchmark assessments align with the grade of the student. For example, a 3rd grader would receive maybe the beginning of the year 3rd grade NLM reading subtest. So those grades match up. The kid is in 3rd grade, I administer the 3rd grade NLM. This is important because benchmark scores are compared to the criteria or what is expected for that grade level. Now, when you go to Progress Monitor, though, this same student may need additional supports and may receive intervention. So their ability is maybe more aligned with like a 2nd grade level. So you might want to consider administering this 2nd grade progress monitoring passages. You can administer outside of the grade level for progress monitoring because you are comparing the student's score to their own performance. And here are the subtests that measure decoding, including decoding inventory, orthographic mapping, phonemic awareness, and phoneme manipulation. This is for all grades, kindergarten and higher. The Cubed 3 aligns beautifully with Scarborough's reading rope. If you're familiar with that, it assesses both the upper language strands and the lower decoding strands. And in the next couple slides here, I'm going to zoom in a little bit. This graphic shows specifically how each of the subtests map onto the reading rope. In the next couple of slides, I will zoom in on the language portion and then the decoding portion. But I think this is just a great graphic that shows everything combined. Now this is zoomed in view of the NLM subtests that map onto the language strands. So you've got like the NLM retell, the questions, vocab complexity, inferential vocabulary, sentence complexity, inferential reasoning, and then narrative discourse complexity and expository discourse complexity. Similarly, these are the subtests within the Cube 3 that map onto the decoding strands of the reading rope. So you've got orthographic mapping, the reading fluency, decoding inventory, phonemic awareness, and phoneme manipulation. The Digital Cube 3 offers multiple ways to group your students based on needs. It is so easy and efficient. You literally just click a couple of boxes and then students are grouped based on need. You can toggle back and forth between the students who need decoding support or language support or a combination of the two. This program also allows you to get even more specific. For example, for some reason, let's say you want to group students who struggle with the NLM retell and maybe are at moderate risk for phonemic awareness. You can do this in 2 clicks. The visuals also offer a quick way to monitor progress for your entire classroom or caseload. Again, check out LDG's website if you would like more information on the digital version of the Cube 3. Or you can scan the QR code here in the bottom right. Here's another example of the visuals and graphs that are available within the digital version of the Cube 3 to help monitor progress over time. These are great if you need to explain the student's progress to a parent or maybe even to the student. It's just such a great way to visualize the data. For the benchmark assessments, risk levels are also generated, as well as recommendations for intervention. Now, these are available for both the language and decoding subtests. This is very helpful to know where exactly do we start intervention with this student, or what is still needed. This is another timeline that you might find helpful as an example of when to implement Story Champs and the Cubed 3 within the MTSLS system. But again, there are also flowcharts within the Cubed 3 manual that you may find helpful as well. This flowchart in particular starts out on top with a universal screening. Then based on how many students perform at benchmark, it provides you with a pathway to follow. For example, if most of the students are meeting benchmark expectations, then continue with the ELA instruction as usual and provide supplemental small group Story Champs intervention to those few who did not meet benchmark. Then you will benchmark again in early winter. For those few students who continue to not meet benchmark, then one-on-one intervention is warranted. Continue to progress monitor and benchmark and repeat the cycle. The last product I want to mention is the Diamond, the dynamic measure of oral narrative discourse. Upon its publication, this will be the first standardized norm reference dynamic assessment of language and decoding. The age range will span from kindergarten to 8th grade. We are finalizing the analyses as we speak, but as of right now, the sensitivity and specificity are falling in the mid to high 90s with the inclusion of culturally and linguistically diverse students. This assessment will allow educators to accurately diagnose for language disorder and dyslexia. Now remember, this may or may not be necessary within the MTSLS framework. This aligns more with the RTI system, but I think it's important to note because if students are not making progress within Tier 2 or Tier 3, the Diamond will be a good option for a diagnostic tool. Here are some great reasons to advocate for the inclusion of language within MTSLS. Increased appreciation of oral language and explicit instruction. So we have known the importance of oral language, but with the use of Story Champs, teachers see the immediate rewards for students as they improve speaking and listening skills. Story Champs provides a much needed framework for oral language instruction that is explicit, systematic, and cumulative. Additionally, Story Champs can be added as a supplement for all students. In one of the studies, there were 3 districts who had 1 experimental classroom and 1 control classroom in every elementary school in the district. After the study, the staff were anxious to implement Story Champs in the control classrooms and did so. By the next school year, they expanded to all grade levels and began implementing in other early elementary grade levels. So by the following year, there was so much success from the students who participated that 2 of the school districts in the study wrote Story Champs into their general education core curriculum, as well as keeping universal screening and small group intervention for Tier 2. Due to the high level of evidence and successful implementation, many other districts around the country continue to add Story Champs to their curriculum. Advocacy for the language portion of MTSLS is so important, and many speech language pathologists are pressured to provide services in a more traditional manner for their students and do not move beyond this model. So only serving those students who are on an IEP and serving them with limited collaboration with others. However, through the implementation of Story Champs, many educators better understood and appreciated the benefits of having the SLP work in a more inclusive and collaborative way. As SLPs took on training and coaching, the staff began to see the SLPs as leaders and the language experts that they truly are. As a result, there was this heightened appreciation of SLP's expertise and additional job security. Here's an example of how one group advocated for their position within the MTSLS framework. So in this one district, there are pressures to outsource or even reduce the SLP staff. The SLPs in that district used the study as evidence and support for their role within MTSLS. They got in front of the school board twice. They were even written up in the local paper, and they worked in highly visible ways in their building. The result was a new awareness of their expertise in language and how that contributes to the school. SLPs were there as the language experts, but they were heavily involved in database decision making as a part of the MTSLS team. They also supported the Tier 2 interventionists, and they supported and trained the classroom teachers to implement the Tier 1 classroom interventions. I think we can all agree that these SLPs were noticed by their district and successfully advocated for their place within the school system. So as I wrap up this discussion tonight, I hope you can see the benefits of an MTSLS framework and that the information I presented sparks a desire to implement these practices within your own school. And as a reminder, don't forget to join Dr. Megan Kirby next month as she discusses parents and caregivers as language and literacy teachers. There's a QR code here, and I believe we can also drop the link in the chat. And in addition, if you would like more information on training, please follow this QR code where you'll find many different options and different ways you can have training for yourself or for your whole school or even district-wide. And last but not least, here's the QR code for tonight's session where you can get a certificate for listening to this webinar. Please contact us with any questions, and thank you again for joining me this evening. I really appreciate your time. We do have a couple minutes though, if anyone does have some questions that were unanswered in the chat. How's it looking there, Christy?
Hey, we just have one question. I'm not sure if you know it this, but Ellie had asked, was the dynamic assessment for, I believe this was in reference to the diamond, when it was completed in Guatemala, Arizona, and Utah, was it ever given in Spanish or was it only in English for the data that was collected?
That's a good question. So that was actually in reference to the Pearl. I do know there is a Spanish version though. My guess is the Guatemala study was Spanish, but I am not certain about the other ones. I do know we have data for both though. Definitely check out Language Dynamics Group website and look at the research tab there, and you'll find all of these studies that go more in depth.
Awesome. Thanks, Lisa. And I threw a lot of extra links in there. So the research link is somewhere in the chat if you care to find it, or you can just go to our website and navigate from there.
I will say the infographics there are phenomenal. So if you are not into reading those manuscripts, which I do not blame you one bit, that is not for everyone, definitely go check those out. I think
Absolutely.
Ellie may have another question. I see she raised her hand. Is there another question in the chat?
Yeah, I'm going to allow her to talk so she can just
Cool.
ask it directly.
Hi, Ellie.
Hey, thank you so much. This is awesome. Yeah, a bunch of SLPs. I'm in Portland, Oregon, and we are really looking at language dynamics as, leaders in shifting, these patterns that we're seeing that are pretty fossilized, especially for students of color. Let's see. So I think what is tricky is that specifically for a principal who is willing to buy the materials, they are wondering, because they're working on the schedule right now and really into, doing this in a evidence and research-based way. They're wondering for what are the recommendations for dosage, because there's already a curriculum in place, whether, I think the cube is going to tell us how much that is actually, finding success in, or like meeting the standards in oral language. But in terms of it being an intervention, either for tier 1 and tier 2, can you give some specific recommendations? Like, is it 15 minutes? Is it a half hour? Because some of it gets into a barrier for implementation.
Absolutely. Off the top of my head, what is coming to mind, obviously, if we can do it 5 days a week, that would be phenomenal. But the research is even showing just a couple of days of the week is effective, and 20 minutes, I believe, is the recommended dosage. But I would need to double check and cross-reference those studies that are on LDG's website.
Because I did I did try to find it, but I couldn't find a specific amount of minutes. I did see it was flexible with days a week, but we wanted like a firm minutes.
Yeah, 20 minutes should be the average. 15 minutes is the lowest of the low rate that we have worked on in
Right.
research, but 20 minutes is generally the average.
Okay. And obviously 5 days a week is ideal. Is there like a minimum amount that has shown the kind of progress you're talking about for days per week?
I know at least for some more recent studies, the minimum that we've worked with is 2 days a week, and that still has shown gains. Obviously, it's going to be a little bit slower in the rate of gains, but
Hmm?
yeah, based on that
Thank-
research, minimum of 2 days a week.
That's super helpful. Thank you.
Mhm. Thank you for your questions, Ellie.
Okay, we don't have any other questions in the chat that I'm seeing.
No problem. Well, if you guys think of questions and they come to you later, definitely email us at training@languagedynamicsgroup.com. And we just really appreciate you guys joining us this evening. And don't forget to get your certificate. So thank you. And have a great night, everyone.
Thanks, Elisa.
Thank you.